Hi everybody, it's Lorraine Scapins from pregnancyexercise.co.nz, pre and postnatal exercise and wellness specialist of many years, way over 25 years now, like it says on the website. Okay, so today's session is all about postnatal pelvic floors, looking after your pelvic floor muscles and how to return safely to exercise, to return to optimal function, and to be able to return to the sports we love. Okay, so what we need to know kind of immediately postpartum. So today we're going to look at activation. Do we need to be activating the pelvic floor muscles or not? We're going to look at professional advice, when it's advised, when it's required, the best time to see a professional. We're going to look at TERS and episiotomies, looking after yourself post those, look at scar tissue, etc., how to look after your scar tissue and manage that. We may get a quick look at prolapse, but today what we really want to go through is to learn exactly what you need to do post-vaginal delivery, post-episiotomy, post-TERing, etc., what to expect from your pelvic floor muscles, the exercises you need to do, and what to look out for so you can exercise safely and you can get back, if you want to those sports you want to function, because our pelvic floor muscles are super important. Not only do they stop us from leaking and laughing, they hold tampons in, enable us to enjoy sex, and we still want all that postpartum. So it's super important that we get to know our pelvic floor muscles, what's going on, and what happened during birth. Now, one of the most important factors that mums need to know postpartum for recovery is whether to relax, contract, and at what time do we need, at what week, day, should we start to do any type of exercise. Okay, so a little brief on your pelvic floor muscles and what happens, and this leads us into more of an understanding of what may be required postpartum, just as an instance. So I'm taking 5 new mums through in the group. I could take 20, 30 women through each week. I'll get you really good feedback. So in a group of 5, I've got one who needs to think about contracting her pelvic floors. The other 4 need to think about relaxing their pelvic floors. Okay. Also, as well, in a group of 11, we had 2 who had C-sections. We had 9 who had second-degree TERS. So all very different, all need looking after differently, and we need to know where we are on the scale of activation and non-activation. All right, so pelvic floor muscles. Let's think of them as a sling. Now, I use this quite a lot, okay? So they're a sling and a ball of muscles. Big group of muscle fibers. So throughout our pregnancy, pelvic floor muscles also come to support our uterus, okay? So they naturally increase in length. Baby's weight, just head grows, puts pressure on the pelvic floor muscles, okay? But they're used to this, okay? Just as your diastasis naturally occurs, okay, there will be some lengthening out of the pelvic floor muscles during pregnancy. Now, the pelvic floor muscles need to give with that, okay, and then we're ready to relax them. So they should be moving like this. This is what your pelvic floor muscles should do, okay? So when we cough, they should be able to spring back up and help and to stop us from leaking, okay? So this is kind of how they should be working, giving way, increasing all the time, contracting and relaxing. Now, once baby's out, okay, we need to reconnect with those muscles and strengthen them back up. Now, for your normal pelvic floor muscles, just as I've said, okay, all right, we have a nice sling. All right, so they should be able to move. So imagine your pelvic floors, contract and relax. What we don't want is this. So where the muscle's very tight, okay, and can't move, All right, so that's where we call hypertonic pelvic floor muscles. Now, symptoms of that can be painful sex, a dull pelvic ache, the feeling of not being able to, it feels like you've got a weak pelvic floor, okay? So you feel full, need to go to the toilet, can't empty out, may have urges. Now, for some mums, if you have an episiotomy, trauma, or a second-degree tear, okay, those muscles, do you know where we move away and grip and tense away from pain? Sometimes that may happen to the pelvic floor muscles, okay? So again, they're going into this hypertonic state postpartum. So that's what we need to work out pretty much immediately postpartum. Have we got the hypertonic muscles, so muscles that are quite tight? Have we got muscles that need to contract in order to resume function? Now, as I said to you, we've got a couple of little tips, cues, things to be aware of to guide us down that road of hypertonic versus non-hypertonic. Okay, best bet, okay, to get it checked is I will then say, well, to a client, I actually think from what you're talking about and what you're saying to me is your pelvic floor muscles might be a little bit tight. I need you to go and see the pelvic floor muscle specialist. So from any time from 3 to 6 weeks, I want you to go in and get checked. If that's the case, they can check straight away and we can start to work on releasing type exercises. Okay, so that's where we need to be. Now, at what stage? Okay, also as well, let me just think about some other things. What can lead to hypertonic pelvic floor muscles is stress, anxiety, tension, because when we tense and stress here, we take a lot of that stress and tension into our pelvic floor muscles as well. So that can also be a sign that things may need to actually relax down there. All right, so any questions, anybody? Start to pop them on as well for me and we can start to have a look at things. All right, so let's go into tears and stitches and when we need to contract the pelvic floor muscles. When can we start to think about this? And the transverse abdominals. All right, so if you've torn or had an episiotomy, different scenarios at the moment, the kind of where we are in New Zealand, the tendency to suggest tearing now, okay, to let them tear, gradually watch the tear before of the need for episiotomy. Some women may tear and then have episiotomy. Again, it depends on your obstetrician, LMC, how things are going as to whether you will tear or have an episiotomy. Now, with stitches, okay, now your pelvic floor muscles are not just kind of a thin piece of tissue. So it's not a surface scratch. You know, a surface scratch, what you do with a knife, is pretty sore and stingy, but it will generally heal within a couple of days. All right, now when we start to get up to that second and third degree, an episiotomy, okay, we've got to think of that fiber. It's actually thicker than that, okay? So when they use their instruments to cut you, okay, or if it's torn, it's actually really quite thick, your tissue, okay? And it needs to be, it makes a noise, it is actually quite thick, so they're cutting through a lot of tissue. Now, if we think about that in terms of scar tissue after, so you're kind of thinking about a slice running through almost the thickness of your finger. Now, that would be sore, wouldn't it? Okay, and that would need quite a bit of healing, and sometimes it can take 30 minutes to stitch you up post your vaginal delivery, which is the same time it can take to stitch you up after a C-section because of the amount of layers and stitching which needs to happen. Now, when we have a C-section, I teach our members, clients, etc. throughout the Birth to Fit and Fit Mum programs the importance of scar tissue massage to help with the healing process. Okay, but are we often taught that about our internal recovery? Absolutely not. Okay, so again, this is where your pelvic floor health specialist will come in and help, because massage of internal scar tissue stitches postpartum is very, very beneficial and will help us heal quicker and more optimally. Again, looking for down the road. Okay, so better functioning pelvic floor muscles, improved sex without pain, etc., less leaking, less discomfort, less bleeding. You can get infections, don't forget, from your stitches, etc. So when you've had second degree tearing stitches and episiotomies, I want you to try and think of your recovery as similar to a C-section. Also, as well, within the first couple of weeks, what happens when we have stitches or we have a cut? We have a lot of inflammation to the area because we have increased fluid to the area, because it's sending all the cells to help heal through that. So when there's extra fluid, okay, going on through the area, so internally we can't see it, we can't feel it, it might just feel a little bit uncomfortable, it's really hard for the brain to connect to the pelvic floor muscles. So don't do it, okay, for 7 to 14 days, which is kind of 7 to 14 days, 21. If more healing needs to happen, you will know that from your own body, because again, the brain can't connect. So what if you've had that? Okay, I want you to go like you've had your C-section. So we start to think about activating the transverse muscles to help support our core, to help support our back muscles whilst the stitches are healing. Once the stitches have healed, we're then down on where we know whether we need to learn to relax the pelvic floor muscles or we need to contract them. If we need to contract them, we can start going on with our pick up a raisin and release, making sure we have full activation. Now, sometimes, again, when there's been scar tissue, there's damage through here, sometimes it's hard to actually activate from the front. Okay, so it's good to think of a back to front scoop. So we think stop a fart, pick up a raisin, and that should help that frontal activation. That's quite normal following this type of delivery to have lost sensation at the front, okay, and to need help. You can always put your fingers here as well, because that's a great guide to know if you are lifting up from the front. I try and tell mums to just try and think that they're stopping a tampon from falling out, and that will start to think that you're definitely starting to work through those frontal muscle groups. All right, so you can do 10 reps morning, lunchtime and night. For those of you learning to relax, we do on the exhale, contract transverse only, and then on the breath in, you work on the release as you would have done during your pregnancy. Okay, so when we exhale, transverse only, and breathing in, work on the release. All right, during the whole of this time, okay, I would suggest not only working on the Birth to Fit Mum program, have someone who can advise you, have your pelvic floor muscle specialist around. Once you've gone for those initial consultation to find out where you are on the scale with your pelvic floor muscles, I would suggest, again, with your advisor, to maybe go back 6 to 8 weeks later to see how things are progressing. So that's where we go on and we start to follow on from your exercise. So we need to get what we need to know in those first 3 to 5 weeks post recovery of our pelvic floor muscles. Then we can start to train as we go down the functional route with squats, lunges, etc., increasing load, learning when we can add intensity, because we need to intensity and impact. Okay, so we need to prepare if we want to start running, okay, through the postpartum recovery. It's not great just to go out straight for a run. We need to prepare the pelvic floor muscles for that impact, and we need to start doing that with the exercises. In the Birth to Fit Mum program, there is a full section on pelvic floor, returning to running. It goes through all your strength exercises, through your impact exercises, what to look out for, how to manage things, if you're leaking, when to dial it back, fatigue of the muscles. Remember, your pelvic floor muscles are like any other muscle group, and we need to use them in strength and endurance, and obviously through the impact for that optimal recovery. Okay, so hopefully I've covered a lot for you though. Please take away from today the two most important things is giving yourself time after a vaginal birth, just like you would do after a C-section. If you've had tearing, episiotomy, ventouse, forceps, etc., be aware of your pelvic floor muscles. Could I have hypertonic pelvic floor muscles? Do I need to learn how to contract my pelvic floor muscles? And symptoms to note day to day. All right, everybody, I hope you enjoyed today's video. Please, if you think of any comments and questions, place them down for me. Make sure you're following us on all our channels. Go onto the website for more information. I've also still got the coupon code Mother's Day, which gives you 30% discount off our program. So please, again, share that with friends and family. Look out for next week events and workouts. All right, everybody, take care. Speak to you all soon, and I hope you enjoyed today's session. Bye, everybody.